from veterinary perspective, when we're treating these horses, one of the things that we want to do is we obviously need to manage the acute disease, and then we need to try and stop it from coming back. And the drugs play a role in that, but that's not necessarily the one-size-fits-all approach. Sometimes it's difficult to administer, sometimes we have issues associated with feeding, which is something we've increasingly grown to recognise with omeprazole. And so what we try and do is identify the risk factors that cause disease, and by identifying those, we try and address those risk factors and remove them from the horse's life to reduce the risk of the disease recurring in the future. One of the common situations we have, though, is a horse like my horse here, Dr. D, who really doesn't have any of the risk factors for disease, but keeps getting disease. And Dr. D here keeps getting glandular disease every competition season. And by the end of the year, it's affected him quite significantly in terms of his weight loss and his desire to work. And so we can't really pull the risk factors out because there's none there in his lifestyle. He's already got a good quality life. He has good quality feeding. He lives with other horses. He exercises a limited number of days a week, and we still have disease. And so being able to use something like the GastroAID range, and Dr. D's on GastroAID Recovery, during that high risk period to reduce that risk of disease further is something that's really, really effective in managing our high performance horses. And he's done fabulously on it so far. We've got a range of our horses on, some of them on GastroAID Recovery, some of them on Everyday, and we've been really happy with the results so far with how our horses look, how they perform, and how they're doing overall.